male midwives in the maternal health paradigm, a scoping review. Any disclosures are displayed on the screen. I'd like to begin with, next slide, please. Thank you. I would like to begin with some background and aims of this lit review. As we all know, midwives provide skilled preventative care to childbearing women and infants throughout the perinatal period. And in many cultures, midwifery has traditionally been a predominantly female profession. However, there is a growing proportion of men in midwifery as shown in the literature, which prompted us to conduct a scoping review to understand the experiences of male midwives, both in the workplace and in training. Next slide, please. The methods employed for this scoping review, for the lit search, we performed the lit search using a semantic scholar and Google Scholar with specific keywords to include gender, men, midwifery, and nurse midwife. For our inclusion criteria, we included primary research paper from PubMed or Gray Literature reports, literature that focused on male midwives in training or workplace, and included articles that were published between the years 2000 and 2023. And we did this because we wanted to see trends between these between the two decades, 2000 to 2023. For our exclusion criteria, we focused exclusively on nursing. We excluded papers that focused exclusively on nursing, especially male nurses, papers that focused exclusively on female midwives, papers that was published before the year 2000, and any paper that was not primary research, for example, a book chapter. Next slide, please. For paper screening, we followed a two-step screening process where titles and abstract were initially reviewed for relevance to our research questions, and then subsequently the full text article that met the inclusion criteria were thoroughly reviewed. For our data analysis aspect, we reviewed the included papers for key themes and patterns within the literature and examining the findings, discussions, and conclusions of the included papers. Next slide, please. We also, for the results, we also incorporated a Prisma flow diagram to depict the number of papers identified, screened, and included at each stage of the study. We initially started with 66, and one duplicate was found. We ended up with 51 studies to be included in the review. Next slide, please. For, as shown on this slide here, the map above, we grouped the papers according to the geographic region, and this grouping was based on the geographic location of the study population. In the literature search and selection process, we discovered a significant number of findings specifically related to Africa. Out of the total number of articles included in the study, 25 articles, accounting for 49% of the selected papers, focused on the experience of male midwives in Africa, with only one from Asia and about a third from Europe. As you can see on the table below, that more papers were published in the second decade, 2011 to 2023. Next slide, please. For the themes that emerged, the first theme that emerged in the training experience aspect, male midwives in African, Middle Eastern, and Asian settings reported more stressful training experiences. And on the right, for example, a research study conducted in South Africa involved a focus group comprising of 40 students, and its finding revealed that factors such as prejudice, rejection, and resistance exhibited by women in maternity units had a significant impact on the training. Next slide, please. The second theme that emerged from in terms of pregnancy birthing experiences from the birthing person perspective, a significant number of birthing persons prefer female midwives for their care. And on the right, in a research study conducted in Zimbabwe, the preferences of expectant mothers regarding the gender of midwives were explored. The study involved surveying 100 women, and the findings indicated a consistent preference for female midwives, regardless of the age of the birthing mother. However, an interesting observation emerged when examining specific age groups. As you can see above, among the 15 to 20 age group, none of the participants preferred female midwives. In contrast, expectant mothers in the 21 to 30 age group displayed a high preference for male midwives, suggesting a glimmer of hope for change. It appears that there is a potential role for male midwives, particularly among teenagers and young adults. Next slide, please. And the final theme that emerged in terms of pregnancy or birthing experiences from the male midwife perspective, most male midwives have experienced discrimination in their career due to cultural conventions and gender stereotypes. And on the right is an example of a national survey that was conducted in America. And it explored the experiences of midwives, and the findings of the study revealed 4 overarching themes that captured the challenges they faced. These themes highlighted the difficulties of feeling singled out as different and experiencing exclusion, despite their genuine pride in being midwives. Next slide, please. To conclude, given the rise of men in midwifery, educational programs should address gender and cultural norms that limits the impact of male midwives. Male midwives have the power to challenge cultural norms and promote gender inclusivity in maternal health care. And on the framework below that we're proposing is to foster gender inclusivity. Educational programs should implement strategies such as using gender-neutral language and imagery, highlighting successful male midwives as role models, and emphasizing the accessibility of midwifery to all genders. Another is providing cultural sensitivity training in the midwifery curriculum to emphasize empathy for male midwives and the midwives of all genders. And finally, community engagement and outreach play a pivotal role in raising awareness and fostering acceptance of male midwifery. This can be achieved through organizing workshops, talks, and information sessions, as well as involving community members in conversations about male midwifery. Male midwives bring unique contributions to the maternal advocacy space by providing empathetic care, advocating for gender inclusivity, and bringing gaps with reluctant population. My anecdotal experiences from Ghana, where male midwives expressed their commitment to providing exceptional care based on how they would want their loved ones to be treated, highlight the significance of their role. Additionally, the preference of teenagers for male midwives underscores the potential impact of male midwives in meeting specific needs. Thank you. That's our reference slide, and looking forward to questions and feedback at the end. Thank you.
Thank you. Thank you very much. I can speak as a male midwife. I request we write our questions. We'll ask them at the end of the session. I want to invite our next speaker,